Welcome back. Today we are going to learn MR spectroscopy for brain. Spectroscopy is diagnostic test for measuring biochemical changes in brain, especially in cases of tumors. Different chemicals are analyzed to differentiate or to make the diagnosis for different types of tumors. The chemicals that are analyzed include choline, creatinine, myoinositol, and NAA, and others also. First, we will perform simple brain with contrast study. As you can see, we have completed our brain sequences. The video is previously uploaded for the planning of brain. Then we will add brain spectrolocalizer. I prefer spectro post contrast. So here is my spectrolocalizer T1. The spectrolocalizer does not show any angles, so we just have to make sure the brain is covered within the slices like this. Then we take the spectroscopy procedure from the list of the protocols. We have used multivoxel spectro. The reason that I used post contrast spectro is that this gives exact size of the lesion, excluding the abscess or fluid area caused by the lesion. So here we have T1 post contrast localizer for spectro. As you can see the difference of lesion in others also. First we will decide our image of interest where the lesion is visualized very well. So I guess this is the right image. This blue box is for the spectroscopy box. This will cover the whole lesion like this. We will avoid air, water or fluid and bone in the spectroscopy box, and we can arrange the size according to the lesion as well. Then here we can apply spectro. This is the grid. We will apply grid in such a way that the spectro box contains complete boxes of grid. These green boxes are for the grid, and blue box single box will cover the whole boxes of the grid. We can see if the boxes are complete like these inside, then we can get the ratios and values of chemicals for these boxes. We will make sure that the spectro box line should be outside of the grid boxes. If this is not outside or like this, we will not receive the image or the values of this box. So we make sure that the blue line or the spectroscopy box line should be outside the grid boxes. Okay, now we will proceed, and the most important thing is this saturation band. We can arrange saturation bands in two different ways. One is covering the brain and joining the corners of the spectroscopy box like this, and another way is to make this parallel to the four sides of the spectroscopy box, whichever you like. We will proceed with prep scan. We will do the prep scan for some of the values that will be shown on the screen, and that will tell us if our planning is right or not. So here are the values. This line width should be between 5 to 15 hertz, and this supply level should be more than 85%. So the values are correct, and we will further press this green button to start the scan. This is the planning for MR spectroscopy brain. For other queries regarding spectro, you can ask in the question box. While the spectroscopy for this lesion is done, we can see the ratios and levels of different chemicals we can see here. We will select the spectroscopy and open it in ready view. Here we get different peaks of chemicals that are enhanced here. These are different peaks. According to these peaks, the radiologist decide which type of lesion or tumor is this. For others, you can ask in comments. Thank you.